Mr. President, the Republican Party controls the presidency, the Senate, and the House of Representatives. And despite that trifecta, the government has been shut down for 15 long days and counting. As an American sufferer, Majority Leader Thune and Speaker Mike Johnson insist that congressional Republicans will address expiring Affordable Care Act health insurance premium tax credits after the government reopens. But do the American people have any reason to believe that congressional Republicans really are going to work to help save health care for millions of Americans? Not if you look at the record. In the past 8 months, Democrats have repeatedly tried to extend these ACA premium tax credits. What does it boil down to? Health insurance is expensive. For some families, it's too expensive. We created a program to provide tax credits for many families who otherwise couldn't have a good health insurance policy. The Republicans in the big, beautiful blue budget, whatever they called it, ended up basically eliminating these tax credits, which means the burden will fall on these families without any help in the tax code in a matter of weeks. In the past 8 months, we have tried to extend these tax credits, which were eliminated in the Trump big, beautiful budget. In February, Senator Shaheen of New Hampshire offered an amendment to the first budget resolution to protect these tax credits. Senate Republicans voted against it, and the amendment failed. In April, Senator Shaheen went again and offered another amendment to the second budget resolution, doing exactly the same things. Once again, the Republicans had a chance to correct the error they made in this big, beautiful budget, but they voted against it. In June, Senator John Ossoff of Georgia offered an amendment to the Republicans' One Big Beautiful bill to save the enhanced premium tax credit a third time. You know what happened. You could guess it. Every Senate Republican voted against the amendment. It failed. And let us not forget that for the past 15 years, the American people have been waiting for the Republican Party's Affordable Care Act replacement plan. In Donald Trump's first term, he made an attempt to repeal the Affordable Care Act. He wouldn't describe to the American people what he was going to replace it with, but he was damn determined to get it repealed. It led to a moment I'll never forget on the floor of the Senate. It was about 2 or 3 in the morning. All the members were in their seats, and it came down to one person as to whether or not the Affordable Care Act would be repealed under the Trump administration in his first term. It was a moment of high drama because we knew what was at stake. Millions of American families, without the help of the Affordable Care Act, couldn't buy or afford health insurance. So it came down to the vote of John McCain, former senator, Republican from Arizona. He went through those doors to my right and was gone for a few minutes, and people said, he's talking to President Trump. Trump's trying to convince him to put an end to Obamacare, the Affordable Care Act, once and for all. John McCain was his own man. He wasn't a creature of membership in an organization. He voted his conscience. He walked through that door, a hush fell all over the chamber. He stood in the well right on that corner of that table and lifted his right arm as far as he could. You remember his arm was broken many times when he was a prisoner of war, and came down hard with a no. And with that single vote, John McCain saved the Affordable Care Act for millions of Americans and gave them health insurance they could afford for their families. The Republicans had failed again to put an end to the Affordable Care Act. Well, here they are doing the same thing with the big, beautiful budget bill. And what does it mean for families? Chuck Schumer was on the floor earlier this morning talking about the impact on premiums. Each state has a target date when the health insurance industry is going to announce the new premiums for the new calendar year, which starts in just a few weeks. Our date in Illinois is October 27th. 12 days from today, those who are part of healthcare.gov, those who are part of the Affordable Care Act, will find out what happens to their premiums. If history is any indicator, it shows that my Republican colleagues have no plan. They didn't have one in Trump's first term. They certainly don't have one now. President said when he was asked point blank, "What's your plan to replace Obamacare?" He had concepts of a plan in his mind, nothing in writing, to make health care more affordable for the American people. So it's a bit over the top for the Republicans to ask Democrats and the American people to wait and trust them to fix this issue, to let the premiums go up, and then maybe they'll get around to changing the law. That is what this is all about. There are a lot of things, words used on the floor of the Senate to describe the government shutdown. I'm sorry it's reached this point, but I think there's a reason for it, and it's a good one. We believe that 20 million American families will see the cost of health insurance go up because of the Trump budget and reach a point where it's not affordable for many families to have health insurance. How about that? What about your family? If you're a person who has health insurance, children, perhaps someone in your family with a serious illness, you understand the value of health insurance and you understand your vulnerability. One broken bone, one automobile accident, one bad diagnosis, and you're going to end up with a bill you cannot pay. It'll exhaust your savings. That's the reality of the cost of health insurance. But my Republican colleagues, like the one who just spoke, don't seem to understand that, and I think he should. What's at stake here is not a political cussing match. What's at stake here is a decision by this body to help millions of American families. If Republicans in Congress fail to extend the enhanced premium tax credits before the end of this year, and that's just a few weeks away, premiums for 22 million Americans will double. Take a look at what you're paying each month for health insurance for your family. Multiply times 2, and that's the result of the big, beautiful bill that was passed by the Republicans. Let me give you an example. In Illinois, a 60-year-old couple with an income of $82,000 could see their annual premiums increase $17,000 a year if the enhanced premium tax credits are not extended. That's an increase of $1,400 a month. Ask any family, working family, whether paying $1,400 a month more for health insurance will have an impact on the family budget. You know the answer. Now compare that the additional cost to the tax cuts that some billionaires will enjoy because of the so-called Big Beautiful Bill Act that was passed by the Republicans. Billionaires will receive a tax cut of more than $310,000 a year. I am sure Elon Musk needs that money. $25,000 a month in tax breaks. So contrast those two numbers. An increase in health insurance premiums of $1,400 a month because of the Republicans' vote, and an increase in the tax breaks, the reduction of taxes for billionaires in America of $25,000 a month. That includes more than 100,000 people in my home state of Illinois who will be forced to make the impossible decision that most Americans pray that they'll never have to make, like whether to purchase groceries or insulin, or whether to pay the mortgage or take the kids in for that checkup. Don't take my word for it. Listen to what my constituents have written to me. Stephanie from Evanston, Illinois, is a business owner, and many business owners count on healthcare.gov for their health insurance. Stephanie told me that if her enhanced ACA tax credits are allowed to expire, the result of the big, beautiful bill, the Trump budget, it would, quote, cripple her budget, and that she's, quote, not sure she could cover the doubling of this cost. Most people wouldn't be able to. She asked me how our country claims to support business owners if they can't afford to take care of their family health. More than 4 million other small business owners who get their health coverage through the Affordable Care Act are asking the same question. Take Jennifer. She's a mother and a small business owner from Illinois who told me her costs have skyrocketed under this president. She told me her food costs are up and, quote, utilities are up, gas is expensive, and the cost of supplies for my business have tripled. Now, Jennifer is concerned that her ACA premiums will double next year unless we do something. That is what the shutdown is all about. It is not some source of pride for politicians to argue back and forth. There's a purpose in this debate, The purpose is to make sure that we come to the rescue of tens of millions of Americans who face the doubling of their health insurance premiums. Jennifer's concerned that her ACL premiums will double, as I mentioned, next year. If that happens, she would have, quote, no choice but to pass those costs on to my customers or to close my doors. As you know, Mr. President, small businesses employ almost 50% of private sector workers. They are the engine of our economy. If our nation's small businesses start closing, there'll be a ripple effect throughout our local economy. And it will happen in part because Republicans in Congress refuse to lower health care costs. I like John Thune. He's the Republican leader here in the Senate. We've known one another for years. We have our differences politically, but I think he's basically a good person. And I've heard him come to the floor over and over again saying, pass this clean, continuing resolution, open the government, and by golly, we're going to sit down and talk to you about health insurance. Why can't we do that now? Why can't we do it this morning? There are enough tables in this building for people to gather. Now that the House of Representatives is back in town, they can participate as well. We need the president at the table as well, as far as I'm concerned. There are many Republicans who will basically wait for a signal from the president to agree to anything. He should be at the table. He brought in the ceasefire into the Middle East. Let's see if he can bring a ceasefire to the Senate and House. It's past time to address this issue. Insurance companies are making their final decisions about monthly premium costs for next year right now. They've sent out notifications, and people will soon be picking their health care plans based on these costs. As I mentioned, October 27th is a target date for this announcement in Illinois. I guarantee you, if we don't bring some relief to these families, we're going to see premiums increase dramatically. That is what this government shutdown is all about. We want to sit down and deal with health care costs directly and now. Leader Thune and Speaker Johnson seem to have made the political calculation. When it comes to tax cuts for millionaires and billionaires, they have no problem moving fast and breaking things. But when it comes to health care for more than 20 million Americans, that can wait. My constituents, like Stephanie and Jennifer and their families, can't wait any longer. It's time to get this done. And one last point, Mr. President. I'm from downstate Illinois. I live in Springfield, 200 miles south of Chicago. I am honored to represent the city of Chicago, and I basically do my best to represent the entire state. We have problems downstate because of these healthcare costs as well. Nearly 400,000 Illinoisans currently receive the ACA tax credits, which are at risk of disappearing because of the Republican vote. If the tax credits are not extended, eligible enrollees will pay an average of $1,032 more per year in Illinois for their health care coverage, $1,700 more per year in rural areas. Small town, rural Illinois is going to feel this as well. These increases will be higher for families. A 60-year-old couple earning $82,000 a year would see an annual increase of $17,000, $1,400 a month. A family of four earning $64,000 a year in downstate Illinois would see an annual premium increase of 226%, $2,571. Counties that will be hardest hit financially are conservative, Republican-dominated counties by and large. Hamilton County will see an increase of $2,772 a year. White County, $2,496 more a year. And Union County, $2,400 more a year. Counties with the highest number of enrollees impacted: Cook County, our largest, $170,500. DuPage County, $35,900, and Lake County, $23,200. We estimate that we will lose up to 9 hospitals in downstate Illinois because of changes in Medicaid and because of these increases in health insurance premiums. Is that a concern? It is to me. I've represented these downstate counties for many years, and I know what it means to lose a hospital. I know what it means to add 45 minutes to an hour to your drive time for the delivery of that baby or critical traumatic care. It really makes the difference between life and death. That's worth fighting for. Before the sun sets today, let us hope that at some table here in the United States Capitol, the leaders of Congress will meet and the president will promise to join them in an effort to get this solved. There's no reason we can't do it. We hear from the Republicans, they want to make some changes. Let's make those changes now and make sure that we get this done quickly. Mr. President, I yield the floor.